Indiana paused its distribution of the Johnson & Johnson vaccine earlier this week after 6 women who had received the vaccine developed blood clots. The women were between the ages of 18 and 48, and one has since died. Now that led the CDC and FDA to recommend pausing the use of the vaccine and left sites scrambling to reschedule appointments. Healthcare providers who have been combating vaccine hesitancy worry about potential unintended consequences of the pause. Brock Turner has the story.
Ryan Engelking and his team at Engelking RX in Mitchell found out about the decision to pause the use of Johnson & Johnson vaccines through media reports early Tuesday morning. 2 of his staff members spent the day on the phone calling about 200 people who were scheduled to receive the vaccine there this week.
It's challenging because it changes our workflow a little bit. You know, we come in expecting one thing, but in reality, we had to deal with this and we did it head on. I mean, we took it upon us to get a hold of the patients and let them know what was going on.
Vaccine clinics across the state had to take similar steps. Around 6,000 people were scheduled to get the Johnson & Johnson vaccine at a mass clinic at the Indianapolis Motor Speedway this week. The state quickly shelved those shots and replaced them with the 2-dose Moderna vaccine. DePaul scrapped its plans to administer the J&J vaccine to around 500 students and staff. The State Department of Health helped the school get doses of the Pfizer vaccine instead.
We know we've got students as well as employees, their dependents, their household members who have not been vaccinated yet, and we're counting on this vaccine opportunity. What can we do? And at that point, what we asked them for was actually to provide us Pfizer on campus.
The government says there are no greater risk of clots from the Pfizer and Moderna vaccines, unlike those handful of women who developed them after taking the J&J vaccine. But the clot concerns could undermine public confidence in all of the COVID-19 vaccines.
The main skepticism that I am seeing is not, political conspiracy theory, microchip, stuff like that, but we're seeing it's just so new. Angela, it's only been out, it's not been out a year. How can you trust something that is that new? And so we're constantly trying to educate them.
This setback comes as COVID cases and deaths in Indiana continue to climb. The state topped 700,000 confirmed cases this week, while the death toll is inching closer to 13,000. The positivity rate across Indiana has steadily increased for 2 months. Engelking says only about half of the people his staff contacted to reschedule their vaccines did.
About half were interested. They want to go ahead and get vaccinated, so they were going to take what they could, what was available and what they could get. And I would say probably the other half wanted to wait for the Johnson & Johnson.
But health officials warn the state is in a race against more infectious variants. Getting people vaccinated is the key, they say, to preventing a third wave of the virus. Cox worries some people will use the FDA's decision as confirmation bias that all vaccines were rushed or unsafe. While she understands the hesitancy, she's keeping her trust in proven scientific methods.
What this means is that our process works. That's why it takes so long for a medication to come through the U.S., and we're used to that. So to me, it didn't scare me, it didn't worry me, it just instilled in me that we have a safe and good process, and we're working the plan.
Around 20% of Hoosiers are considered fully vaccinated. More than 130,000 have received the one-shot Johnson & Johnson vaccine, though none of the reported cases of blood clots have been linked back to Indiana. For Indiana News Desk, I'm Brock Turner.
We're joined now by Graham McKean, the Assistant Director of Public and Environmental Health at IU, to talk more about the vaccines. Hello, Graham. Were you surprised that the Johnson & Johnson vaccine was put on hold, knowing that there were just those 6 cases of blood clots out of more than 6 million doses administered?
After reading about it, not surprised, but personally a little surprised at the beginning. I did not read personally the phase 3 trial data where they did say there could be a potential association with these ultra rare blood clots. But it's so rare, it's really hard to make those associations until millions of people have been vaccinated. So I'm also not surprised, as they were just saying, this is how the system is supposed to work. This is why we pay the FDA, the CDC, and these third-party safety boards to do these things. And there's an incredibly high bar of safety with respect to vaccines, and we're seeing that process work in real time. And the risk of severe blood clots from COVID infection remains much higher than any risk of any vaccine.
What impact will taking the Johnson & Johnson vaccine out of the rotation mean?
It doesn't help. I think the bigger impact might be hesitancy, even though there should be a lot of trust in this process. But honestly, the J&J supply really wasn't quite there yet. It only accounted for about 9% of all U.S. immunizations. What I think we missed the most with this vaccine is the attractiveness and convenience of a one-dose series, especially for transient groups or others that might be hard to track down or complete those two-dose series. So luckily, we have a good supply of the mRNA vaccines, and maybe we'll see the CDC committee maybe recommend that younger folks get this or not get this particular vaccine.
There's already a lot of COVID fatigue. Now with the issues with the vaccines, how concerned are you people will just, throw their hands up?
Yeah, I think we're constantly concerned about that, but I think we also need to keep in mind that 560,000 Americans have died of this, and if we throw our hands up, this will probably only last longer. More concerning variants could emerge, more people could be severely ill, hospitalized, or worse. So our fastest way forward is to sign up for one of these amazing mRNA vaccines. They're incredible safety profiles. We've now administered nearly 200 million of them in the U.S. over several months with without any safety signals.
All right, thank you very much for your time. Appreciate it. And of course, there'll be more to come, I'm sure.
Thank you.